to 22 degrees. Light winds becoming fresh easterlies tonight. Occasionally strong offshore winds will moderate gradually later tomorrow. Outlook, there will be a few rain patches on Monday morning, becoming fine and dry in the afternoon. Cool mornings in the next couple of days. Currently, it's 23, humidity 71. That's your weather from your radio, Metro Plus, your connect.
With the Stay Home Safe scheme, epidemic prevention resources can be reserved for the needy, and we can protect our healthcare system. If you are suitable for home quarantine, stay home at all times during the quarantine period. Monitor your health condition, conduct regular tests, and observe the home quarantine guidelines. Call the hotline 1-833-019 if you need help. Let's do our part. With our concerted efforts, Hong Kong will overcome the epidemic.
Ang opinyon ng programang ito ay mula sa host at ang kanilang panauhin at di nangangahulugang opinyon ng estasyong ito, Metro Plus AM 1044.
Tunog Pinoy.
Hawak kamay, di kita iiwan sa paglakbay.
Tunog Pinoy.
Wala na bang pag-ibig sa puso mo at di mo na kailangan?
Tunog Pinoy.
Dahil ikaw ang sigaw ng puso ko, ikaw ang nasa isip ko, ang nais ko ay malaman.
Tunog Pinoy, alas 8:30, Huwebes at Biyernes at Sabado mula alas 9 hanggang alas 11 ng gabi dito sa Plus AM 1044.
Ibig ko sa'yo ibibigay.
Ain't it funny? Is it just beginner's luck? Maybe with just a touch. Two different people from such different worlds apart has touched each other's heart like candles in the dark. If it's time for us, we've gotta take it, take the chance to make it now. Let the love begin, let the light come shining in. Who knows where the road will lead us now? Look at what we found. Make this moment turn our hearts around. It may never come again. Let it in. Let the love begin.
Here we are,
us together. I can feel the fire start between us.
We've come this far, too far to stop it now. If this is meant to be,
It's meant to
a
be
chance for you and me.
for you and
We
me.
found our destiny,
Now
looking at a new forever.
make this dream come true together now. Let the love begin. Let the light come shining in. Who knows where the road will lead us now? Look at what we found. Make this moment turn our hearts around. It may never come again. Let the love begin. I'll call you next week.
Gino Padilla with Let the Love Begin at 8:37 Tunog Pinoy Sabado night all the way till 11 o'clock. But before that, since it's the first 30 minutes of the program, hello po and welcome sa ating program. And in the past couple of weeks, we've been doing something really different dahil on the first 30 minutes, or rather, yeah, nakakasama natin si Kuya Mike on a Saturday evening for, syempre, updates dito sa ating Hong Kong and sa Philippines. Kuya Mike, hello!
Thank you very much. Sa ating mga balita po sa araw na ito, Hong Kong saw the COVID-19 infection numbers drop from over 50,000 in the past few days, 37,529 this Saturday, and reported 150 related deaths. Of the fresh cases reported today, only 6 were imported cases and all others were local cases. The Department of Health Principal Medical and Health Officer Albert Au said that brings the total to 427,978 infections since the fifth wave started so far. That means umpisa po ito ng buwan ng Enero 2022. He continued that the COVID has hit 60 more care centers in Hong Kong, involving 428 residents and 200 staffers from 47 elderly homes and 13 care centers for the disabled. The fifth wave of the pandemic has seen some 11,000 residents and 3,100 workers from 589 care centers infected in total. Hospital Authority Chief Manager Larry Lee said 150 more deaths in the past 24 hours, involving 90 men and 60 women aged 32 and 105. Lee said that 82 disease patients were residents of care centers and 109 didn't have any vaccination record. Only 21 of them received 2 doses of COVID-19 vaccines. 1 received a booster jab, and 19 had gotten only 1 jab. The newly reported deaths, 137, were elders, age 65 and above, and 6 patients were comparatively younger, including a 32-year-old woman. The woman had received 2 doses of Sinovac and a booster of BioNTech. She tested positive using the rapid test kit on February 28th and was admitted to the Prince of Margaret Hospital on Wednesday because of a neck mass and difficulties in breathing. Lee said that the neck mass may have been triggered by her cancer and have nothing to do with the COVID infection. Lee also reported 70 deaths between February and March 3rd, involving 44 men and 26 women aged between 40 and 104 due to lagged results. A total of 1,561 patients passed away in the fifth wave of the pandemic. About 70% of the disease patients were elderly people, aged above 80, and over 85% suffered from chronic disease before COVID-19 infected them. Lee continued that 61 patients are in critical condition, 109 in serious. Among them, 70% didn't receive any COVID-19 vaccines. Over 8,000 have been infected with the coronavirus and 1,300 have resumed duties already, according to health authorities. Just reminder po sa mga kababayan po natin, ano, na if you get your rapid test, let's say, ngayong araw na ito, umpisa po yun ng first day nyo po, no? Consider yourself, don't test na po kung kayo po'y positive. Don't test until the fourth day, no? The sixth day and the seventh day. Pag nag-okay na kayo ng dalawang beses sunod-sunod, 6 to 7, according to the information we got from the hospital authority, you're actually clear to go and doing normal chores already. Okay? Ang pinaka-importante lang dyan, manmanan nyo po yung lagnat, no? Na hindi siya umakyat ng convulsion level, which is 40 and above. And then, manmanan rin nyo po yung shortness of breath. No? Ibig sabihin nun, yung hinahabol nyo po yung paghinga nyo. Kasi normally, ganun po na yung nangyayari. And also watch out for, kumbaga, yung pagkawala po ng pangamoy at panglasa. Okay? Sa iba po nating mga balita, the government said on Saturday that the employers illegally firing foreign domestic workers infected with COVID-19 would never be tolerated and is against the law. The SAR government doesn't and will not tolerate any employer's illegal dismissing foreign domestic helpers who have suffered from COVID 19 and in violation of the employment ordinance, a spokesperson from the Labor Department said this afternoon. Under the ordinance, an employer is prohibited from terminating the contract of employment of their domestic helper on her paid sickness day, which is applicable po ito. Alam naman po natin kung kayo po ay nagkakasakit or you're under medication based on pre-COVID situations. No? Ibig sabihin nun, hindi pa tayo nagkaka-experience ng COVID. Except in cases of summary dismissal due to the latter's serious misconduct. Ibig sabihin nun, kaya nga gusto kong alalahanin niyo po ito, no, ng maigi na dapat alam ng employer nyo kung ano yung ginagawa nyo during the course of time kung kayo po ay nag-isolate, nakapag-antigen po kayo, no? Lahat po ng steps na yan alam nila para hindi po nila pwedeng baliktarin na, oh, hindi nila pinaalam sa amin eh, di ba? May mga ganong mga employer. So, make sure po yun. The employer commits an offense if one doesn't or one does so and would face a maximum penalty of $100,000 upon conviction. He stressed that employed helpers who tested positive for COVID 19 or are listed close contacts of confirmed patients will receive support like any other citizens of Hong Kong. For helpers currently without employment in Hong Kong, the Labor Department has been assisting in their admission to suitable facilities with the support and assistance of relevant consulates or consulate generals, he said. Totoo po ito, no? So kung kayo po'y in between employment, meaning natapos na po yung kontrata nyo or kayo po'y na-terminate na dati nyo pong amo, then you move on to another one, syempre meron pong period po yun, no? There's a median period na you're in between employers. So, doon po dapat kayo lumapit kaagad sa consulate, no? Kung hindi man kayo lumapit sa consulate, come to us and we will help you. We will get your details and we will personally submit your information directly, okay? Directly to the consulate. Importante po yun. And DJ Jin, marami na tayo natulungan doon regarding that, di ba?
Oh, yeah.
May mga ilan na po, no? People who were displaced dahil sila po yung na-bump off dahil positive po sila. I think we've already helped about 5.
Yes.
The same way with Eva kagabi. The same way with Rona. Tama ba? Si Rona ba? Yung
Roda.
sa Chingy. The other day, nung Thursday. Di ba?
Si
Si Roda.
Roda.
Si Roda pala,
Oo.
nung Thursday. Di ba? Na na-meet natin. Ganun din po yun. Ano? So you have to report right away. Kasi para hindi po kayo malagay sa sitwasyon na nasa gitna po kayo, you're neither in a shelter and or yung inyong current or magiging employer. Mahirap po yun, ano? That's very difficult. The spokesperson also said, also thanked helpers for their support in the anti-pandemic fight by staying at home on their rest days to minimize people's flow. The spokesperson noted that 330,000 foreign domestic helpers, mostly from the Philippines and Indonesia, are serving local families in Hong Kong, and said both the government and the local community greatly value their contribution. The SAR will stay vigilant in taking enforcement actions against any violation of law in liaison and collaboration with the relevant consul generals. Okay. Um, meron din akong na-experience today.
Mm-hmm.
Ah, na may tumawag sa atin,
Mm-hmm.
no? And because na meron siyang dalawang alaga
Mm-hmm.
na younger kids sa bahay, at nag-positive siya after actually having herself tested, eh tumawag siya sa atin kanina. At sinabi niya sa atin naghahanap daw siya ng lugar na kung saan na makapag-ano siya, na quarantine siya. Kasi nga natatakot siya baka mahawaan nga yung dalawang bata. True enough, that is a kumbaga I would say very compassionate, no, move sa ating kung sa ating ika nga OFW. But you have to be very careful when you act on such situation. Kasi may mga iba na okay na lang yun, na the employer will tolerate it, pero they can also turn, di ba, the story in another way. Na umalis siya, hindi ko alam. So, kailangan amicable po yun dun sa employer at saka sa employee. Siguraduhin nyo po na ganun po siya. Kasi, when the time comes na hindi po kayo nagkakaintindihan, napakabigat po nun i-explain. No? Again, this will come to the point na he said, she said. Alam mo yun, ano? Di ba?
Yay.
Yung sinabi ko at sinabi ng employer nyo. Eh, kasi wala tayong pumapagitna doon eh. 'Di ba? Eh dapat yung pumapagitna, no? Kinakailangan 'yun eh making sure na nagkakaintindihan po kayo. 'Di ba? So importante po 'yun, no? So 'yun. Tapos isa pa sa dapat yung pong pagtuunan ng pansin that again, yung explanation ko po kanina, no? Yung shortness of breath, yung pangangamoy, panglasa nyo po, and make sure yung pagtaas po ng yung pagtaas ng anong tawag dito, ng inyong lagnat, kung meron man po kayong lagnat. Ngayon, ito yung sasabihin ko po sa inyo, no? Sakali po na may nag-positive na po sa inyo sa bahay. Okay? Hear this very clearly. Kung may nag-positive na po sa inyo sa bahay, ang standard protocol, double mask na kayo, no? Pag pumapasok at labas po kayo, considering na kung isa lang po ang toilet nyo, wala ho kayong separate toilets with the rest of the family, dapat yon labas, pasok, linis lagi yon.
Mhm.
Okay? Importante dapat yon, ano? Tapos yung mga exhaust nyo, kung may bintana po kayo, may exhaust fan sa taas, tapos bintana sa baba. Tandaan nyo po, yung daloy ng hangin sa baba, maaaring umakyat sa inyo yon through the open window, tapos iikot siya bago lumabas ulit dun sa exhaust fan. Sarahan nyo naman muna yung bintana na yon, no? Kasi we're trying to be cautious as much as we can possibly can. So yun ang pinaka-importante nyo pong gawin, no? And then, i-consider nyo na rin po yung sarili nyo na kung may nahawaan na dun sa bahay nyo, first day nyo na rin yun. No? Tapos bilangin nyo po yung sarili, bumilang po kayo kung let's say, kung meron po kayong antigen, no, test kits, magbilang po kayo ng 5 days, every day po kayo mag-test. Pag nalampasan nyo po yung 4th and 5th day, critical yung 4th eh. Diba? Pag nalampasan nyo po on 5th day, clear po kayo. Yun ang pinaka-importante.
Pero that doesn't necessarily mean na medyo magla-lax kayo, ha? Hindi. You still have to protect yourself. Dahil may kasama kayo.
Oo,
diba?
tama yun.
Oo. Yun yung medyo kailangan i-clear natin sa kanila kasi baka mamaya biglang hindi na sila mag-mask, hindi na sila maglinis. No.
Correct. So, yun po yung dapat yung gawin, ano? Juliet, if you wanna call me, can you call me after my report, no? It's 6641-8811. Paki-WhatsApp lang po muna ako. 6641-8811. Okay? So, another thing na kailangan nyo pong gawin to be
to be frank, is to be able to, no, to be able to calm, yung calm effect.
Yeah.
Okay? Kailangan
And you
meron po kayong
breathe.
calm effect sa bahay.
Yeah.
Importante po kasi yun eh. Kasi kung wala po kayong calming effect sa bahay, lahat yan magpapanik ho lahat yan. Guaranteed po yan. Ano? Yun po yung pinaka-importante. So, you have to make sure, right? You have to make sure na may calming effect po kayo. Kasi pag nagpanic ho kayo, pag sumigaw ang mister ng bahay, ayan
Oo.
kinaklaro ko po yun. Pag sumigaw ang mister ng bahay at sumigaw ka rin sa kanya doon sa sitwasyon na yun, wala na.
Wala na.
Buong bahay niyo po for the rest of the COVID situation,
Sisigawan kayo, guys.
magsisigawan na
Oo.
kayo, di ba? Away na po yan. So, iwasan po natin yon. Okay? And lastly, sa balita po natin ngayon, sabi ng respiratory expert David Hui, naniniwala siya na 15% of the Hong Kong's 7.5 million population have already been infected with COVID-19 and expected that the fifth wave to peak in mid-March. So, 2 weeks. No? Speaking on the radio program, Hui said that the number were deduced based on the 15 to 20% positive results rate detected in the recent lockdown declared at buildings throughout the city and expected the daily caseload to climb continuously. He also referred to other mathematical modeling conducted by other experts and predicted that the infection numbers to reach the ceiling by mid-March and remaining to a top level for a while. He continued that concentrating all COVID patients in one single hospital may not work, and most public hospitals have now admitted COVID patients in their general wards. Giving the example, the Prince of Wales Hospital in Sha Tin, where there are only 2 general wards for non-COVID patients. With that in mind, he called on private hospitals to help treating non-COVID patients to make more room for public hospitals as well. On another note, he urged the government to consider throughout when to impose a citywide mass testing arrangements, adding that it is best not to conduct at the peak of the pandemic. Hui continued that the best time for such arrangement would be the early stages of the pandemic, as authorities could cut off transmission chains in the communities as soon as possible. He advised the government to wait until the infection numbers decline to lower levels, as Hong Kong is now hit by a full-scale outbreak and there are not enough isolation facilities. Hui noted that it would never be enough, no matter how many isolation facilities the government builds, as the number of patients detected in mass testings will definitely exceed the number of units these facilities can provide. He recommended sending priority groups, including elderly people and chronic disease patients, to hospitals first, and those who can undergo home quarantine, like partition flats or partition flat tenants, to isolation facilities. So, yun. Kagaya ng nabanggit po natin, no? Mas maigi na po para ready po kayo is to make sure kayo po ay yung mindset niyo po ay ready na kung tamaan. Yun. Ito medyo nakaka-deers to nabasa ko po, DJ.
Oo.
Okay, so
Grabe
mag-ingat po kayo kung
yun.
sasakay po kayo ng tren. Kasi hindi tayo nakakasigurado.
Or any public
medyo-
any public
Correct.
transpo.
Correct. So, kailangan sa public transport, kung kinakailangan nyo po, bumili na po kayo ng mga plastic gloves, no? Better na yon.
Or
No?
wag
Pero
na kayong
pati yung mga
humawak.
damit ninyo, kung alam nyo na pupunta po kayo sa mga mataong lugar, make sure na pag-uwi nyo sa Pilipinas,
Pwede
pag-uwi nyo
din.
po sa inyong mga bahay-bahay,
Labhan
kailangan
na.
laban na kaagad
Oo.
yun, no? Laban na siya.
Oh,
So,
parang
ito,
babad nyo muna sa sa Dettol.
yes.
Oo.
Okay, ito. A woman who wipe spit. Ibig sabihin nun, dumura siya, tapos
Yeah.
kinalat niya
Yeah.
on an MTR train door in Kowloon Tong Station on Friday morning. Was issued a fixed penalty ticket by police for breaching the mask wearing requirement. The incident took place at about 7 a.m. on Friday, and video footage circulating online showed that the woman took off her mask and wiped her mucus on the train doors before spitting on it. Staffers tried to ask the woman to leave while other passengers were arguing with the woman, including an unhappy passenger who assaulted the woman multiple times and fled the scene. The incident was reported to police, and officers later issued a fixed penalty ticket to the woman for violation of the Prevention of Control and Control of Disease regulation after arriving at the scene. The case has been listed as common assault and is now handled by the Kowloon City Police District. Police added that after further investigation, MTR has charged the woman for obstructing the train operation and refusing to display identification document to staffers, according to the MTR. Alam mo, sabi nga ni ang ganda nung quote ni ni Miss Bakuli. Ang sabi, di ba, MTR, sa kanya, MTR.
Actually, totoo yan.
Yun na daw ang pangalan niya.
Pero medyo
MT.
nagulat ako nung pumasok ako dahil parang daming tao. Medyo.
Today?
Oo, parang than regular.
Okay. Anyway, so yan po ang ating mga balita sa araw na ito. Apologies for taking much of our 8:30 to 9 o'clock hour.
No worries.
Ingat lang po kayo dyan, ano? So, we will try to update you on a regular basis sa ating programa. Take care. Kung kayo po lalabas this weekend, avoid being out as much as you can.
Double
May
mask.
tumatawag na.
Sanitize.
Somebody's calling me already. So, I gotta say goodbye.
Bye-bye.
Ingat po kayo.
Thanks for
Good night.
joining. Good night.
Bye.
Ayan. Maraming salamat po kay Kuya Mike for joining us sa ating programa and updating us sa ating mga balita na mga nangyayari dito sa Hong Kong. And for reminding us nga sa mga kailangan natin gawin. So, anyway, don't go away because up next, after the top of the hour, syempre ang ating power hits only here on Metro Plus, Your Connect. And bringing us to the top of the hour is Nuest with A Daybreak.
From the moon to the stars 우주를 헤매다 서로를 알게 되었죠 그리고 그리다 번진 물감 위에 우리가 흘러내려요 왠지 낯설어 혼자 있는 새벽 공기가 잠 못 이루게 하죠 언제부턴가 커져버린 널 향한 마음 감출 수 없나 봐요 텅 빈 방 가득 비추는 moonlight 꿈처럼 사라져 가지만 새하얀 캔버스에 한 번 더 그려요 혼자가 아니라 믿어요 From the moon to the stars 우주를 헤매다 서로를 알게 되었죠 그리고 그리다 번진 물감 위에 우리가 흘러내려요 까맣게 물든 밤 나는 너의 눈동자 같은 나를 보며 오늘 하루는 어땠을까 난 걱정하지 넌 좋아 보여 패스하고 빠지는 말그릇 맞자 마냥 어린애처럼